I see a lot of patients with a mild form of scoliosis. Scoliosis is when you have that kind of S-shaped curve that goes on one side typically and goes to another side below those segments or above. The body balances itself out over time, right? And this could be due to a lot of different things. It could be congenital, it could even be from something like trauma, it could be from poor posture for a long time, it could be something that happened during a growth spurt, right? And if I had somebody with scoliosis, I would closely monitor them, especially if they were in their pubertal or prepubertal years, right? Now, if you have scoliosis, can a chiropractor fix it? Well, in short, really no with an adjustment. I'm not going to lie to you, I'm going to be real with you. If you have scoliosis, my adjustment is not going to put your spine that's like this, back like this, okay? Now, I can move the freely movable joints, right? I can help to realign the vertebra within, each segment. And we can work on curve that goes front to back, right? To some moderate degree. But when it comes to scoliosis, granted it's not something that's about a 40-degree scoliosis, measured by a Cobb's angle typically, if you were curious, where you would go to an orthopedist, get a brace, right? If you do traction, you can have an effect directly on the curve. So not directly with the adjustment, but yes, with traction, okay? Where, we would basically pull you this way and this way with two separate contraptions, part of one contraption, whatever, two separate belts, however you want to look at it, that will try to straighten your curve over time. Looking at an x-ray and saying, okay, here's the major convexity here, here's the major convexity here, let's pull it like this, okay? Knowing where to put what we're putting on you, right? And that takes an extended period of time, tens of minutes to hours and months of work, right? And you're not even guaranteed a complete change, especially but even a relatively significant change. But I have seen them before. Now in my office, I don't yet have traction, right? So I'm real with my patients. I say, look, I don't like to treat symptoms. I like to get to the root of a problem. 100% always. That's what we do as chiropractors. We try to get to the root of the cause of dis-ease. We don't just treat your symptoms and slap a Band-Aid on things. But when it comes to scoliosis, I have to, in some regard, treat the symptoms by telling you to strengthen the muscles that are going to hold you in a better position to slow the progression of the scoliosis, to slow its progression. That's about the most that I can do there, right? Now, having said that, this is going to improve your life in many other parameters and your overall health. Now, so what do we typically want to strengthen with scoliosis in order to slow its progression over time and to help at least keep it where it is? Core is enormous, okay? So if you have a strong core, it's changing your biomechanics every day, from the way you walk, to the way you lift, to the way you stand. Everything. And it's taking stress off of your low back. We always talk about that for people with low back pain, right? Core strengthening is one of the major things I like to implement in my patients. But it goes for scoliosis as well. And strengthening that core is going to help to keep you in a more upright position and help to prevent that scoliosis from progressing even further than it already has, right? So that's one. A lot of people have a mild case of scoliosis, right? And you can live just fine with this, right? Now, again, if it's a really, really serious scoliosis, significant degree, and we're worried about, pressing on the heart and other structures in the body, well, then of course we're going to send you to an orthopedist. Let's get you a brace. Let's do whatever we can to help correct the problem, right? But in this case, yeah, strengthening the core is huge. You know what's another one that I like is strengthening the muscles between the shoulder blades. And this really goes for almost everybody, not just people with scoliosis. But if you strengthen the muscles between the shoulder blades, then you're going to be like this. And it's going to hold you upright. So think about your scoliosis in this regard if it's a mild form, even if you're not all that worried about it. And if you're wondering if I could help you, or another chiropractor can, let's say, does not have a traction machine, right, which I will have at some point soon. That's the next investment, right? But it's strengthening all these muscles so that you're in good posture, you can support your spine well, and you don't have to worry quite as much about it being progressive, and you don't have to worry quite as much, almost most importantly, about a world of other problems in your life, about degenerative disc disease coming on at a younger age because you're in good posture and there's less pressure on all the discs between your bones, right? About having as much low back pain or neck pain because you're not stuck like this and this. You're upright, right? So that's pretty much what the story is. And you know, I had a question about scoliosis. I had a patient yesterday with it, and I definitely wanted to address that. And I want to be real with you guys and know that we can improve your quality of life as much as possible. But am I going to go in there? Am I going to change that scoliosis? Be lying to you if I said I was, right? In terms of correcting it. So that's what we got for you guys. I think transparency is extremely important, you know, and I should say I know transparency is extremely important. And you know, me in my heart, I'm not going to tell you that I can do something for you that I can't just to get you into my office and get a check, right? It's, you know, it's just not good for anybody, and it's not how I want to practice or live in general. So that's what we got for you guys. I hope you're having a great day. And if you have scoliosis, I can at least help to correct some biomechanical imbalances and to help to strengthen the muscles that support your spine and your core and all sorts of things to help hold you in a better position, give you better prognosis with your scoliosis later in life. Let's see what we got on here. Say what's up to the peeps. And then we're going to go. What's up, Ash? How you doing, girl? For Lick. What's up, Brandon Malone, OG, Manuk, Louise, Jock, Dave, what's up? That's the Beast from Knees. What's up, killer? How you doing, man? Happy whatever day it is, Tuesday. Malcolm, what's up, brother? Good to see you on here, man. Sabia, what's going on? CB, I realized that was you recently, and now you get an OG shout out every time. Irvish, what's going on? As for now. So we got for you folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have an awesome rest of your day. Thanks a lot. Happy One Wellness. If I missed your birthday, Brennan Komsky, this one is for you, my friend. And I think it was yesterday, but you don't have Facebook, so I wasn't 100% sure. I used that to check in. That's good. You don't have Facebook probably, right? Less social media, really the better. Here we are, because this is a platform where I can reach a lot of people and help to improve their health and lives. Otherwise, fuck social media, I wouldn't use it, right? But I do look at Facebook for the birthdays, and you weren't on there. So if it's yesterday or today, you get a happy belated or happy birthday, whatever. And here you go. Happy birthday or belated birthday to you. Happy birthday to you. Happy birthday, dear Brennan Komsky. Happy birthday to you. So many more, man. I'm looking forward to seeing you soon. And partying on the 6th, I can't wait for that. It's going to be a great time. I hope you had a great day on your birthday. Let's make this a great year. What do you say? Yeah, thanks for hopping on. See you guys later. Have a great one. Thanks.